Your blood is supposed to clot when you get a cut or scrape, right? But what happens when your blood starts clotting all over the place, even when there's no injury? That's what happens with disseminated intravascular coagulation, DIC, a serious condition that can be caused by a number of underlying medical issues. DIC is basically when your body's clotting system goes haywire, causing small blood clots to form all over your blood vessels. This can block blood flow to important organs and tissues, and it can also use up all your clotting factors and platelets, leading to bleeding in other parts of your body. DIC can be caused by things like sepsis, a serious bacterial infection, trauma, cancer, pregnancy complications, or certain medications. Symptoms of DIC can vary, but they usually involve some combination of bruising, bleeding from the gums or nose, blood in your urine or stool, and more serious bleeding like gastrointestinal bleeding or bleeding in your brain. In severe cases, DIC can cause organ failure, which can be life-threatening. Diagnosing DIC can be tricky, but doctors will usually run a bunch of tests to check your blood counts, clotting times, and markers of inflammation. They might also use a scoring system to assess how severe your DIC is. Treatment for DIC depends on the underlying cause and how severe your symptoms are. The main goal is to address the underlying medical issue and try to control the abnormal clotting and bleeding. This might involve antibiotics for sepsis, surgery for trauma, or chemotherapy for cancer. You might also need blood transfusions, platelet transfusions, or medications to regulate your blood pressure. In some cases, doctors might use anticoagulant medications to stop further clotting, but this can be a tricky balancing act because it can also increase your risk of bleeding. Taken together, disseminated intravascular coagulation is a complex and potentially life-threatening condition that arises from the abnormal activation of the body's clotting system. DIC can be triggered by a variety of underlying medical conditions, but it is most commonly associated with sepsis. The symptoms of DIC can vary depending on the underlying cause and the severity of the condition, and diagnosis can be challenging. The treatment of DIC depends on the underlying cause and the severity of the condition, but the primary goal is to address the underlying medical condition and control the abnormal clotting and bleeding. With early diagnosis and appropriate treatment, individuals with DIC can achieve good outcomes. If you're worried about DIC, it's always a good idea to talk to your doctor. They can help you figure out if you're at risk and what you can do to stay healthy. With the right care and attention, you can keep your blood flowing smoothly and avoid any nasty surprises.